Good afternoon. This is Lindsay back live at Bone and Joint Institute of Tennessee with Dr. Brian Perkinson today. And today we're talking about a type of knee replacement called a unicompartmental knee replacement. Dr. Perkinson will go into detail about all that in just a minute. But Dr. Perkinson, thank you so much for your time today. Want to tell a little bit about yourself and your specialty?
Yeah, sure, Lindsay. Thank you for having me. My name is Brian Perkinson. I am one of the unicorns from Franklin, so I grew up here, and I grew up being cared for by Dr. Farrell and the surgeons who started the Bone and Joint long ago. I went to Battleground Academy, graduated from there, went to the University of Tennessee. I'm a volunteer. I studied biomedical engineering at Tennessee, and then stayed in Tennessee in Memphis for my medical degree. And then got a fellowship at what's called the Anderson Orthopedic Research Institute, which is in Alexandria, Virginia, which is a wonderful fellowship for doing hip and knee replacement, what we call adult reconstructive surgery. And so I guess today we're going to talk about unicompartmental knees, which is also commonly called partial knee replacement.
Well, before we kind of go into the actual replacement piece, let's talk a little bit about arthritis, because that's the cause for this most of the time. So talk about what non-surgical treatments, before we go into the procedure, what non-surgical treatments would you try first?
Sure. So first of all, arthritis is something that people don't commonly understand. They think it's something that occurs or lands on their joint or grows on their joint. And arthritis is actually not something. It's the lack of something. It's the loss of cartilage over time. So when you grow up, you basically have cartilage, which is a soft white material on the end of your bones. And when the joints come together, that's the bearing surface. That's what rubs against itself. And it's a very frictionless, very forgiving surface. When you're done growing, that's the cartilage you have, and essentially you don't really grow any more cartilage, and that's the cartilage you have for the rest of your life and all the joints in your body. And so over time, your body wears that cartilage down, either from activity, injury, or a genetic component that you have, or other types of arthritis, and basically that leads to what we call bone-on-bone arthritis. Once we have bone-on-bone arthritis, we treat you conservatively for as long as we can. This is going to include medicines by mouth, medicines by topical cream, medicines by injection therapy, and there's different types of those. We also do kind of a full wellness approach of weight loss, healthy activity, which is non-impact exercise. Primarily, that's what we would do as long as we could, until we get to a point where we say, hey, we really can't live like this. It's affecting my life to a degree that I can't do all the things I want to do, and then we start moving into surgical options.
And what once you get to that point, and how do you make the decision, and what surgical options do you have, primarily with the unicompartmental knees that we're talking about today?
So the decision primarily comes through x-rays.
Okay.
So you want to see that the cartilage is no longer present. And specifically for partial knees, you want to see that the cartilage loss occurs in one area of the knee.
Okay.
So you have to have a little anatomy lesson here, which is there are three compartments in the knee. There's the inside, which we call medial, the outside, which we call lateral, and then underneath your kneecap, which we call patellofemoral. So if you look at the knee as three compartments, when you do a full knee replacement, you replace all compartments.
Okay.
So when you're doing a unicompartmental, you're doing a partial knee where you replace one compartment. So you'd want to see on x-ray that that patient has arthritis primarily in one compartment, and that they otherwise have a very functional knee, a knee that has good motion, is not extremely stiff, and does not have large deformity. And if you meet that criteria, which about a third of people with arthritis actually do, then you potentially are a candidate for partial knee replacement.
Okay. And go into a little bit more detail about partial knee replacement. As far as like the procedure, is it typically an inpatient versus outpatient, the advantages, just a little bit more detail.
So partial knee replacement is almost universally an outpatient procedure. It's a much smaller procedure than a full knee replacement. It's a faster recovery, both on the physical therapy side and on the healing side. It has a lot lower complication rates, just because by nature it's a smaller surgery. It's a less invasive procedure, and so outcomes for it are very good.
Okay, excellent. And so let's go back. You mentioned physical therapy. So after you have a unicompartmental knee replacement, talk a little bit about the recovery process. Do you need therapy? Do you just go home to recover?
So you're doing it outpatient. It's a very rapid recovery. You're walking the day of surgery. Usually you're walking out on a walker, transitioning to a cane within 3 to 5 days, and then you're on a cane for a brief time. Usually by 2 weeks you're off everything. And walking independently without any assist device. You're in physical therapy on average about 4 weeks. You're icing, you're elevating, and you're following your physical therapist lead on how you're progressing your activity level. And then usually by 4 to 6 weeks, patients are doing very, very well.
Excellent, excellent. So let's go back to kind of the prevention piece. I know you mentioned little things as far as exercise, weight management, things like that, but are there any other things that someone can do to prevent arthritis?
So that's always the question, and the answer to that is really no.
No. Okay.
You really can't prevent arthritis. You can limit the course of arthritis, and the best way is healthy weight, healthy activity. So non-impact exercise protects your joint. And exercise itself actually replenishes the fluid in your joint. So the cartilage in your joint gets its nutrition not from your bloodstream, but from the fluid in the joint called synovial fluid. That synovial fluid is recycled and recreated through motion. And so we know that exercise benefits your body and your joints, benefits the weight on your joints, because the weight on your joints is the force across the joint.
Got it.
And you can't change gravity, but you can only change the mass that creates the force.
Absolutely.
That will preserve your cartilage as long as you can.
Okay.
There are supplements that people use commonly. Glucosamine chondroitin and MSM are probably the most common. I think that is reasonable to a balanced wellness strategy.
Okay.
It would be disingenuous to say those are going to prevent you from getting arthritis.
Absolutely. Okay. Well, thank you for the information. As a wrap up to all of the Facebook Lives that we do here, we kind of talk about the comprehensiveness of Bone and Joint Institute. So give us in your own words, how does Bone and Joint as an entity and all the services that we offer, how does that benefit the patient?
Oh my goodness. So
30 words or less.
Yeah, where do we start?
30 seconds or less.
You know, we could start with the building before you even go to the people inside of it. I mean, we have one of the most modern buildings. Modern technology is provided here. We've invested in basically all the modern techniques you can provide. And we do so. I think an important thing to distinguish ourselves from others here is there are things we actually don't do. For example, we don't do stem cells.
Right.
We don't do stem cells because there's no good data that stem cells actually works.
Absolutely.
And we won't do it until there is. And because those things are heavily cost, they're highly priced, and they're cash. And we're not going to do that, even though that would benefit our revenue and our bottom line.
Absolutely.
We're always going to make those types of decisions for our patients. What we do what's in the evidence scientifically to help people. And so at this time, that's not what we're doing. But in terms of our partners, we have a full array of specialists and subspecialists that can provide everything you need for your orthopedic care, from non-operative doctors all the way to physiatry and injection therapies to keep people away from any surgery, all the way to surgeons who do a generalist type approach, all the way to doctors who do very specific things like myself. We just do knee and hip replacement. From small surgeries for me, like this is a small surgery for me, and partial knee replacement is one of the smallest surgeries I do, all the way to full femur reconstructions. And so there are much larger surgeries that we do, but we all stay within the lane of what we're very good at, and what I'd say we're gifted at, and I think it provides the best care and quality for the patients.
Excellent. Well, Dr. Perkinson, thank you again for your time today. We really appreciate it.
Lindsay, thank you.
You're very welcome. So for any additional questions or to schedule an appointment with Dr. Perkinson, you can give us a call at 615-791-2630 or visit our website at boneandjointtn.org. Thank you again, Dr. Perkinson. Thank you once again.
Thank you. Bye,
Thank you.
guys.